SUTV News. Today we have Chris Liggett from the Exercise Science Club joining us today. The Exercise Science Club is measuring blood pressure for free here at the Wellness Fair. Today we have our live events director, Bubba Smith. He's going to demonstrate how blood pressure is elevated during a high-stress situation. Bubba, how's the fair going today?
So far, so good. I'm anxious to see what my blood pressure is going to look like while I'm directing here.
Okay. And Chris, you're an exercise science major here? Okay. Bubba, what do you expect to see from this reading?
Well, I haven't eaten anything today, and all I've had is coffee. And we are on live television right now, so I'm expecting pretty high numbers.
Okay, Bubba, just give us a second for this reading. Chris, do we have a final number?
45/90.
Wow, and that's elevated, right?
Elevated blood pressure.
Do you think that that could be from Bubba's caffeine intake, no food?
It could be because of his stress. He looks like he's in a pretty high position here, and could be very stressful.
Am I in any serious danger?
You're not in any serious danger.
Okay.
At all.
That's good news.
Okay, Chris, thank you so much for your time. Bubba, we'll let you get back to your job. Now we're going to send it to Steph DeCarolis, who takes a look at how the Exercise Science Club has an impact on the wellness of this campus.
So at first glance, you wouldn't think this is what you do in a campus club. But that's exactly what the Exercise Science Club does.
We learn how to do the blood pressure and take the BMI and the values all in different classes like kinesiology, lifestyles management.
It's a club for students who want careers in health and exercise related fields.
The social engagement along with some of the activities they can put on their resume.
There's fun to be had. Games to play, and eggs to toss? Yes, eggs. And exercise teaching students how to teach coordination.
They take a full slate of coursework, courses that prepare them to be able to perform these assessments.
The officers have a variety of responsibilities.
During the school year, I send out emails to club members advising them about when club meetings are and different volunteer opportunities that they have to participate in.
All of the officers agree it is important for exercise science majors to get involved. The club offers hands-on experience for their future fields.
Being in the exercise science club and having the hands-on experience will help me in my field in the future.
This year, the Exercise Science Club will monitor students and faculty's blood pressure at the Wellness Fair.
During the Wellness Fair, we also pass out papers with the ranges that your value should be in for your blood pressure, so that way you do know if you fall outside of them.
The club meets every other Tuesday and encourages anyone, even non-majors, to join. Stephanie DeCarolis, SUTV News.
Physical therapy are here at the Wellness Fair. They join reporter Sarah Small. Hey, Sarah.
Thanks, Lucy. I'm here with Adam Hart from Ship Sports and Physical Therapy. Hi, Adam. How you doing?
Nice to meet you.
So I wanted to ask you, what services are you providing here at the fair today?
We're just providing information about physical therapy itself and how we can help people in the area.
Okay, great. And what services do you also provide at your local place?
We actually have a HydroTrack. That's one of the best things that we have as far as total hip replacements, total knee replacements, and then just general conditioning, lower back pain. And you can actually take a percentage of your body weight off of you so people can walk with a normal gait pattern when they couldn't outside of the water.
That's very interesting, thanks. So arthritis prevention is something that most students don't know about. They usually think it's just for the older population. Can you tell us how important is it for students to start now in preventing arthritis?
It's extremely important. One of the main things to consider, though, is obviously exercise is the most critical thing that you can do, but exercising the right way, practicing those right biomechanics so that you're not going to further injure those joints. So.
Okay, great. Thanks for joining us today.
No problem.
Today's younger adults are more active, but more prone to injury, too.
Because of the number of sports that people play.
You guys at the
we're
desk?
Seeing knee injuries at epidemic proportions.
Chris Sense and Tom Flown are local therapists who've treated this epidemic.
And what we're seeing more and more of are patients that have initial injuries.
It's a significant knee injury, usually requiring surgery. You're going to probably develop some early onset arthritis.
They get back in activity very quickly, and oftentimes that accelerates the arthritic change in the knee.
Not being active, though, can also cause arthritis.
The other thing that's happening, too, is as a population, we're getting heavier.
That excess weight is causing a lot more impact on the joints with everyday steps.
For every pound of that we put on a body mass, it creates or translates into 4 times that amount of pressure at the knees.
This wear and tear leads to pain. The pain leads to painkillers, and over time, painkillers can be dangerous.
A lot of these anti-inflammatories that aren't COX-2 inhibitors actually will affect the lining of the stomach, and if you take them for a long period of time, which they weren't designed to do.
But there are steps you can take to prevent arthritis completely.
Learning to squat with your legs instead of bending over at your back.
Recovering all of your muscle function before you get back into those activities.
Or switching positions every so often so that you're not doing the same thing over and over again.
Importance of keeping weight down.
Knowing how to do things properly.
Whatever you do, preventing wear and tear is all about making good decisions.
And it doesn't mean you can't be, very, very active. It just means sometimes you need to select your activities a little more wisely.
And exercising wisely can be fun for all ages.
Find out how organizations are making a difference in heart health for veterans. And meet Mary Rose Wilson, who made the Wellness Fair happen. We'll be right back. Mary Rose Wilson is here with us now. Mary Rose is the director of the Wellness Fair. Thanks for joining us, Mary Rose.
Thanks for being here.
What benefits can students get from attending this year's Wellness Fair?
Well, there's information about so many different aspects of health. We have everything from Lyme disease to heart health to skin health. We have free massages, and we have free acupuncture treatments. We have free nutritional counseling. We have free Reiki treatments. So students have an opportunity to try something on that they may have never tried before for free. Plus lots of informational tables. We also have door prizes, so come on in and take advantage of that.
What is different? We covered the Wellness Fair last year. What's different from last year to this year?
Well, we have a few more exhibitors this year. We always have new people coming. So we have a new chiropractor that's here this year. We have a new wound clinic that's here in town, a wound healing clinic. So they're here. We have a couple of extra Reiki practitioners and a number of other exhibitors that haven't been here before, plus a lot of people that keep coming back every year.
So you mentioned some of this events here. So what can students expect when they come here?
Students can expect to get lots of information, to be able to ask questions, to get lots of giveaways, and of course those freebies that we talked about and the door prizes. So it's just a great way to learn more about ways that they can become healthy or retain their health.
You talked about some of these events. What else is going on for the rest of the day? What's the schedule?
Well, the schedule's from 10 to 2. So we'll all be here, all the exhibitors will be here, and all of the therapists will be here as well until 2 o'clock.
Well, thank you so much for joining us today, Mary Rose.
Thank you.
It was a pleasure having you.
Thanks.
The second half of the semester can be stressful for students and faculty. Rachel Snowdy takes a look at a local woman who fights stress one hand at a time.
Some people go to counseling for therapy. Others try a different form of therapy, massage therapy. Emma Kleitz is a certified massage therapist who treats the stresses of everyday life.
Typical massage is good for just relaxation purposes, especially during finals week.
But she's different from other massage therapists.
I also focus on pain management massage, so people who have chronic pain issues.
Emma is a resource for faculty and staff as well as for students.
I was at the Wellness Fair last year just as a spare massage therapist, and since then I've picked up a fairly regular clientele.
Her work helps her clients relax and relieve their stress.
I'm not the best verbal communicator. My hands do my talking for me.
Rachel Snowdy, SUTV News.
Cardiovascular disease and stroke are the #1 cause of death here in Pennsylvania. The American Heart Association's goal is simple: to decrease the likelihood of cardiovascular disease and stroke. I'm here with the local chapter of the American Heart Association. Sharon Strike is a representative for them. Sharon, how are you doing today?
I'm great. Thanks for inviting me today.
Glad to have you. What exactly is the American Heart Association?
Well, first, it's a volunteer organization, and our mission is to reduce cardiovascular disease and stroke, and the deaths from cardiovascular disease and stroke.
Okay, what services are you providing for us here at the fair?
Basically handouts of educational information, and most of the information is about nutrition. There's some on stress management, physical fitness, and blood pressure.
How important are these items to college students?
I think they're very important. The younger you are, I think the less likely you are to think about cardiovascular disease and stroke. Most young people think that only affects people of the older generations. So it's really important that they start now to look at those risk factors for heart disease and stroke.
Well, we'll definitely encourage students to stop by and talk to you, Sharon. Thank you so much for your time. Now we'll send it back to Lucy at the desk.
Thanks, Amanda. One in every 5 soldiers suffers from post-traumatic stress syndrome and needs intensive treatment. Steph Horvath has more.
On the outside, it's just a plain building, but on the inside, the Harrisburg Vet Center is anything but plain.
Are part of the readjustment counseling service for the Veterans Health Administration.
The Vet Center was established in 1979 to help the Vietnam vets adjust to civilian life. Today, the Vet Center helps any veteran who walks in with their discharge papers.
We'll be able to offer a place to come and talk to about any sort of issues that might be coming up because of your service.
Even though the Vet Center is in Harrisburg, there's something you can do right here on campus.
Be friends with a veteran, just make them feel a little welcome, because it can be a bit overwhelming sometimes.
Steph Horvath, SUTV News.
Hi, I'm here with the director of the Pregnancy Resource Center, Robin Kell. Hi, Robin. How you doing?
Hi.
So you can tell us what are you doing here today at the Wellness Center?
What we're doing here today is we have a wheel here that someone can come by and spin, and they'll be asked a question. And the questions that are on that wheel, they all pertain to the drug Plan B. And it's all common knowledge. If someone would go and purchase that, if they take the time to read the patient packet information, they would find all this information. What I come to find out is, even in my own life, if I go to the doctors and I'm sick, I get a drug, how often do we really read that information? And we need to take our time, whatever medications we're taking, to read what kind of side effects there could be, how it will affect our body.
Right, exactly. I agree with you. That's totally important. Could I spin the wheel? Sure, get right ahead. All right, so let's do this here. Hopefully we'll get a good one. All right, number 6.
Number 6, when taking Plan B, is there a risk of ectopic pregnancy?
I'm going to say yes.
Yes, there is.
All right,
yes.
Great. So I got the answer right. All right, thanks so much for joining us today.
Welcome.
Back to you guys.
Thanks, guys. Lucy, do you hear that?
I do. I hear some barking back there.
I think some dogs have joined us here today at the Wellness Fair. There are lots of great tables here set up.
There are. There's a lot.
There's definitely some informative pamphlets. I really encourage you all to come down. We are in the Cub NPR. It's from now until 2. We have live reporters going everywhere and trying to really look and see what else is here. So now let's toss to Sarah.
She's here with the canines. Sarah?
Hi, guys. I'm here with Kay with the Kindly Canines. How you doing, Kay?
I'm fine, thank you.
So what are you guys doing here at the Wellness Fair today?
We're trying to promote therapy for dogs. We take those dogs to nursing homes, to the READS programs at libraries and schools, and the children read to the dogs. And at nursing homes, of course, they get petted, and it brings joy to a lot of them.
I have a dog too, and I love him absolutely. He gives me a lot of joy. What's this guy's name?
This is Trevor.
Trevor. Hey, Trevor. He actually apparently has a lot to say. It's back to you guys at the desk.
The Wellness Fair will run from now until 2 p.m. today. We're in the Cub NPR. It's free admission to get in, so come and check out the fair. There are a lot of health and wellness vendors to give you any information on any of your wellness questions. That's it for this special edition of SUTV News. I'm Amanda Peterson.
And I'm Lucy Davis. Thanks for joining us, and we'll see you tomorrow night.